Dr. Stacey. Welcome to the Genetic Genius Podcast.
Hi, Dr. Lulu. Thank you so much for having me on.
You're so welcome. I'm so excited for us to talk all about the skin today because I love talking about skin. And first of all, I would love for you to just introduce yourself to our listeners. Just describe what you do, your passion, because you have such a wonderful, unique niche.
Yeah, thank you so much. My passion is healing the skin, specifically healing acne. And that passion came about because in my late 20s, I had a massive acne breakout when I stopped the birth control pill.
Mm.
And I had no idea what to do for it. I tried everything I could think of. I didn't want to go the medication route,
Mhm.
and I just couldn't get rid of my acne. So eventually, that led me to naturopathic medicine. I went back to school, became a naturopathic doctor, learned how to balance the body from the inside out, started practicing, working with acne patients, and the rest is history. That is my passion, healing acne. Honestly,
Yeah.
Lulu, I could talk about it all day, and I do, but it's one of those things, like, you get it, right? When you're
Right.
really into something, you're just like so into it.
Yeah, which is great. When that passion comes through, it makes other people passionate. And so many people have not chronic skin conditions, but a lot of people are looking for health and alternative help because I know I have a lot of patients who come to me that they've tried a lot of different pharmaceuticals or traditional methods that fail over and over again. So it's so great that you're such a great resource for that. And I can't wait for us to find out more about what you're doing.
Yeah, it's fun.
Okay, can we just start at the basics? Because I love to start there. And can you just talk about what acne is and why it's such a big deal?
Well, one thing acne is not, is it's not a skin issue.
Right. Exactly.
Right? So, I think our culture, we've been led to believe that acne is a skin issue, and we have to tackle it by putting topicals on.
Yep.
And, that's where we have to address it. When in reality, acne is a result of a lot of different physiological mechanisms going on in the body.
Hmm.
No, it's related to the gut. It's related to our ability to detoxify properly. It's related to our ability to manage stress properly. Insulin regulation, it's related to that. So it's actually, a very complex condition.
Yeah,
And
totally.
yeah, and it needs to be treated as such so
Hmm.
that we can get rid of it entirely, instead of, being on this vicious cycle, where
Yeah.
something helps a little bit, but then it comes back,
Yeah.
and so many people, have been suffering dealing with their skin that way.
Yeah, and it can be scarring, life scarring,
Mm.
physically, but emotionally too. It's a huge aspect, especially for teens, you know, and
Mm.
young women and men who are going through that. It can be very challenging. So as
Yeah, in
far,
fact,
yeah,
there's research.
sorry, go ahead.
No, sorry, there's research out there that shows us that people that have acne have higher levels of depression,
Hmm.
higher levels of anxiety, and lower levels of self-esteem. It's really a big deal. It affects people
Yeah.
very deeply.
It makes total sense. Total sense. And your skin looks beautiful, by the way. You can tell that you figured out the magic in that.
Thank you.
But I think it took some work, which we're gonna find out.
We can all have skin that's beautiful and glowing.
That's right.
That's what our body wants to give us. We just
Yeah.
have to give it the tools to manifest that.
Yeah, that's totally true. I love that. So it sounds like there's a lot of naturopathic tools in your toolbox. Let's start with the gut because I think that you mentioned a couple of things and I want to dive deeper into some of those today. And so, how does the gut play a role in? I mean, this is amazing. And one of my favorite topics is the skin and gut. And how does inflammation and poor digestion, how does that all influence how our skin is looking?
Oh, I love talking about this too. So, as you know, the gut and the skin are very, very closely related. And
Totally.
the thing that ties the two together, there's a few things, but the main thing is the microbiome,
Mm,
because the microbiome exists in two places. It exists in the gut and it exists on the skin.
hmm.
And if the microbiome in the gut is healthy, then chances are the microbiome on the skin is going to be healthy,
Mm-hmm.
because the skin's microbiome does reflect the gut's microbiome.
Right. It's like a little mirror of what's going on in our gut.
Yes. And so if the microbiome is off, if there's dysbiosis, certain cytokines, can create inflammation in the
Mm,
body. And that
mhm.
inflammation, for those that are susceptible, manifests on the skin. So
Totally.
that's one way that, the skin and the gut are deeply connected. The other way is if there's a situation of leaky gut,
Mm-hmm.
where certain proteins are able to get into the bloodstream from the gut, because those enterocytes, they're supposed to really be close together. And
Mm-hmm.
when they're not close together, when they're damaged, when they're inflamed, then that can create an immune reaction, and that inflammation can show up on the skin.
Yeah.
Mhm.
Totally. And are the cytokines that you mentioned, are those connected? And you mentioned stress in the beginning. And the stress is something we've seen such a huge play on in the past 15 months or so, or maybe year.
Yeah.
And are the cytokines are impacted by stress, correct?
Yes,
And so if
absolutely.
you're under more stress, then the cytokines in the gut are going to be impacted. Is that correct?
Yeah, absolutely. I mean, stress has such a huge role in the health of the gut and in the health of the microbiome. And those cytokines, absolutely, they're affected, which
Mm-hmm.
creates more inflammation and makes the skin even worse. And I think that
Yeah.
stress is one of those things that people don't associate with the health of their skin.
Mm.
You know, as much as it has such an impact on the skin. I mean, especially in a situation such as acne, there are 3 different biochemical processes
Mm.
that stress stimulates that lead it directly to acne. So
Oh,
there's a
wow.
really, really strong connection there.
Yeah, it sounds like a very deep connection, not just superficial.
No, no, that's
Okay, so you mentioned the gut and the microbiome, which is so key for healthy skin. And what about elimination? So we're talking constipation and how our gut is processing different things.
yeah, absolutely. I mean, glucuronidase is a really big issue when it comes to the skin. And if you are not having daily bowel movements,
Mm.
then, there's a buildup of estrogen in the
Mm.
body, and that can contribute to hormonal acne. So we need to be eliminating every single day, having daily bowel movements. That's a really big factor when it comes to healing acne. Absolutely.
Mhm. So it sounds like you have the poop talk with your patients too.
We definitely have the poop talk. And, the other thing when it comes to elimination and the gut is that, eliminating foods that are aggravating the gut and creating more inflammation in the gut. That's absolutely necessary as well, because it's kind of like adding fuel to a fire. If you have
Mhm.
inflammation in your gut and that is the fire, when you eat foods that aggravate, it's like just throwing fuel on the fire.
Right,
Right? So we need to
totally.
remove those foods for a period of time to allow the gut to heal and
Mhm.
reduce that inflammation.
So do you do or do you recommend food allergy testing as part of an aspect of healing the skin and working with acne conditions?
I do. I do like food allergy testing, but even more than that, I love a good elimination diet.
Totally. Mhm. Yep, that's the hardcore stuff, right?
Yes, that's my favorite, because we're not only discovering food sensitivities, but we're also uncovering food intolerances.
Mhm.
Yeah,
Yeah, can
so
you explain the difference between those to our listeners? I think that's a little key point there.
food sensitivities occur when there's an immune reaction, whereas food intolerances occur when you have difficulty digesting foods.
Mhm.
And you can have difficulty digesting foods if you don't have an adequate amount of enzymes, if there's inflammation in the gut, if there's a dysbiosis in the gut, that can all prevent food from being properly digested. Whereas, food sensitivities is really just when proteins have migrated from the gut into the bloodstream, and that creates an immune complex
Mm-hmm.
reaction. So
Right.
they can be very different.
Yeah. And so that can create a different type of immune response on the skin, it sounds like.
It can,
Mm-hmm.
absolutely. And I find that acne patients, they really have more food intolerances, food
Mm-hmm.
sensitivities. And people with eczema and psoriasis, they really have more food sensitivities.
Mm-hmm.
So
So there's a
there's definitely a
difference.
difference there.
Yeah. Oh, great. And so when it comes to just back what you said about elimination, you were saying that at least having one healthy bowel movement a day. And let's talk about the estrogen component that you mentioned, because I think that's a key piece for us to kind of move back to, since we'll be talking about hormones anyway. So,
Yes.
I think that's a commonly known that hormones or hormonal imbalance can affect the skin. So let's dive in there. How does that work? What's the process?
Yeah. So, I mean, if you have acne, you have an elevated amount of androgens in your body.
Hmm.
That's just what happens. And there's a number of things that can cause elevated androgens in your body. One of them being, an imbalance in the estrogen and the progesterone levels.
Right. And that can
And
happen just in women and in men. It's both.
absolutely both, because both women and men, have acne.
Right. Yes, exactly.
Right.
Some people always think men commonly think, or my men patients are like, well, I have estrogen. Like, yes,
Yeah.
you do.
So, I mean, Lulu, I used to really treat on the level of the hormones. I do a Dutch, I'd find out where,
Hmm.
what the hormone situation was, where the estrogens were, the progesterones, the androgens, and treat based on that. But, in the past few years, I've really gone even, treated at a deeper level,
Right.
and addressed the pillars that lead
Hmm.
to inflammation, because it's inflammation in the body
Hmm.
that really creates a hormonal imbalance when it comes right down to it.
Yeah, that's so true. I love that. And so I think you mentioned on your website too that the liver detoxification is a key aspect. So can you talk about how the liver and the hormones are connected, and then about the piece about so kind of like, I don't know, combining that all together, because I think that's such a fascinating aspect, because people don't think about that. How, the liver, detoxifying the liver can help the skin because it's part of the hormonal piece.
Oh, it's such a big part of it. So, I mean, if our body is not detoxifying properly, the liver, the liver is a really big part of that. What happens is the hormones remain in the system, right?
Right.
So the liver's not able to conjugate them and
Hmm.
put them into a form where they're able to be eliminated from the body, and we get an excess of hormones. And estrogens are especially, bad for this. When we get a buildup of estrogens,
Hmm.
that's one of the main things that can lead to hormonal acne and an imbalance in hormones. So, supporting the liver and also supporting the lymphatic system makes a big
Mm.
difference as well. I really love to support both of those organs at the same time.
Hmm. Oh, that's great. What are some ways that you work with patients in helping the liver and the lymphatic system to function, more efficiently, and to get get things out?
Yeah, so a lot. I mean, diet is a really big one.
Mm.
There's so many foods that really can help support the liver. Cruciferous vegetables are great,
Hmm.
berries are really good,
Hmm.
drinking enough water. And there's also a lot of great naturopathic therapies I use.
Hmm.
Castor oil packs
Oh,
are
yeah,
really
that's a good one.
dry brushing is good. Hydrotherapy is really fantastic.
Hmm.
Um, Complex homeopathy, I actually use that a lot, and that is
Nice.
fantastic to help the lymphatic system work properly. And then there's all the amazing nutraceuticals that we have that can
Right.
that
We have a lot.
really we have so many that really support phase 2 detoxification, like
Yeah.
and glutathione and some of the herbs that we use. But there's
Hmm.
there's so many amazing ways to
Hmm.
help support the body's ability to detoxify. It's really endless.
Yeah, totally. And are there specific, like, how do you know your liver is not working well or you're toxic, is it going to show up on your skin? Are there some other signs, I guess is my bigger question there. Are there other signs you might be looking for? Like, are you fatigued, or is your poop going to look a specific color, or, things like that?
So often when acne is on the jawline,
Mm,
right here, and it tends to
mm-hmm.
be more cystic, and it cycles with your period, that's a really big sign that your liver needs some support.
Oh, yeah.
Um,
Okay.
yeah, that's a really big one. Other signs in the body, fatigue is a really big sign. Itchy skin, itchy nose,
Mm-hmm.
ears, those are really big ones. Also, if the bowels are not moving regularly, that can be a sign because you don't have enough bile, because bile is really
Right.
important to stimulate bowel movements. That's a really important one. Gosh, I mean, if you're just feeling unwell, you know,
Right. Yeah.
that can be a sign that
Yeah.
you're not detoxing properly.
Yes, this is true. Yeah, it has so many different effects on the body, doesn't it? It's amazing. What I was going to ask you about well, it'll come back to me. There was a thought and then I lost it for a second. It'll come back. Okay, so it sounds like that looking at the hormones, the liver, and the gut are kind of those key components. Oh, I know. I was going to ask you: do environmental aspects affect the way like we're moving into allergy season, and does that affect the skin in relationship to acne at all? Do you see that or is it more from the internal perspective, as you were talking about with the gut and food sensitivities?
Yeah. So allergies can affect the level of inflammation in the body overall,
Mm-hmm,
right?
mm-hmm,
And when the
right.
body is more inflamed, the skin is going to be more reactive. And
Mm,
that goes for acne as well. So if you're experiencing allergies, your body is going to be more reactive. So you might even react to a skin cream more
right.
acutely,
Yeah.
or like stress, you'll react to stress more acutely. It's just
Mm-hmm.
everything is kind of like more sensitive.
More turned up. The volume is turned up on the radio,
Yeah.
your reaction dial. Yeah.
Mhm.
Okay, great. Yeah, good. Because I think that's, there's so many different connections to the skin. And I feel like that it's so interesting to talk about how, and it sounds like it all comes back to that inflammatory pillar you were mentioning earlier, which is a
Mhm.
big piece of that foundation for sure. Okay, so what other organs? So the liver is part of our detox. Do we have other organs in the system that are part of that detox pathway that could be making the acne flare up or making the acne worse?
So the lymph, I
Lymph
mean,
system.
that's
Mm-hmm.
that's one that I mentioned. And when there's stagnation in the lymphatic system, that's when I see a lot of cystic acne. Acne that
Right.
just doesn't clear easily. So that's a really, really big one. And I mean, the skin is like the body's biggest organ of
That's
detoxification,
right.
right?
Totally.
So
Yeah.
when the body's not detoxifying properly, the skin takes the brunt.
Mm-hmm.
So, right. So if there's something going on with the skin, chances are the body's not eliminating somewhere along the line, right?
Right. Totally. What about body odor? Does that a specific sign that something is not going right with the detoxification system?
Body odor, I really, think of that more as a dysbiosis,
Mm-hmm.
because there's an imbalance in the microbiome on the skin, and these bacteria, are creating an odor,
Right.
as
Oh,
they,
yeah.
yeah. So I always think of it more like a microbiome thing.
Microbiome, which still could have that effect on the skin, sounds like. Hmm.
Mhm,
Wow.
mhm.
Yeah, that's interesting. And then so, some patients I've seen don't have the same sweat ability, when they are perspiring. Does that affect the skin and skin irritation?
Absolutely, it does. When people are not able to sweat efficiently, that's a sign they're not detoxifying well. And right?
Mhm, right.
So the body's going to be more reactive. The skin's going to be more reactive as it tries to just deal with that toxic overload.
Yeah. How do you increase your sweat or your ability to
Yeah.
perspire?
Yeah, it's kind of like practice. You know, like
I'm gonna go practice sweating today. I'll see you later.
I'm serious. Like doing saunas, you know, the
Right.
more
Yes.
you do saunas, the
Right.
more your body actually learns to sweat and
Yeah.
release toxins. And also supporting, you know, supporting your liver, making sure that you're drinking enough water, you
Right.
know, just really supporting all of those systems, supporting the microbiome.
Hmm.
But yeah, really, when I have patients that can't sweat, we try and practice. You know,
Right.
doing saunas is a good one.
Yeah, that's great. And so you mentioned hydrotherapy before. Is that part of the sauna aspect that you're talking about, or is that a different therapy?
Oh, it can be integrated as part of the sauna. I
Mm-hmm.
mean, that's so fabulous, right? To do like 20 minutes in the sauna and then a minute to 3 minutes under cold water.
Ooh, yeah. Mm-hmm.
That's amazing, amazing for stimulating the vagus nerve.
Yeah.
But then, you know, hydrotherapy in the shower, that's a great thing to do.
Mm-hmm.
So doing 3 minutes of hot water, one
Mm-hmm.
minute of cold water, you know, just to really move the lymphatic system, move
Yeah.
the blood within the body and just really get that deep detoxification.
Oh, that sounds great. Love it.
Mhm.
Yeah. And so that helps. So the lymphatic system that you were mentioning earlier, could you describe that to our listeners a little bit? Because I think that some are the audience, some people are, know that some of the terminology, but I like to break things down too, because, the
Yeah.
lymph is such a huge aspect of our system. And especially now with COVID, it's, we want to have that lymph system really working. But I'd love for you to describe that a little bit more, kind of about its process and why it's so important.
Yeah, absolutely. And I'm obsessed with the lymphatic system. I mean,
Oh,
the more I practice,
good.
you know, medicine, the more I realize that it is absolutely critical for our health. So, you know, the lymphatic system is a system of vessels all through our body,
Mm,
similar to our blood vessels. But instead of having blood run through these vessels, we have a clear liquid called lymph
mhm.
that moves through these vessels. And in addition to the vessels, there's often also lymphatic organs, such as the spleen, such as the adenoids, such as the tonsils, and all the lymph nodes.
Mhm.
And this entire system, it regulates our immune system
Right.
and it becomes stagnant very, very easily
Mm,
because, unlike the circulatory system, we don't have a heart that's
right.
pumping the
So
lymph
lymphatic
fluid.
heart.
Yeah, we don't have a lymphatic heart. So
Yeah.
this lymph moves through our body as a result of us moving and exercising
Right.
and being hydrated enough. And
Mhm.
if those are not in place, it's very
Mm.
easy for the lymph to be stagnated. And this can result in our immune system not being as efficient
Yeah.
and our body not being able to detoxify, you know, as efficiently as it needs to.
So key. Yeah, I love that. Yeah, I use the rebounder machine or the trampoline to
Yes.
really it's so easy, and then it gets the lymph kind of active and gets things moving, and there's so many easy ways. I love that you just mentioned, just exercise, just moving your body even just for a little
Yeah.
bit, especially with all the sitting that many of us have been doing with
Yeah.
zooming and the new way we're working. You just get up and do a little dance move for a few minutes and get some things moving. So it sounds like the lymph is a really key aspect of how our skin is doing.
It really is because the lymph is everywhere in our body.
Mhm.
You know, it reaches all the corners of our body just like the blood does. So,
Yeah.
you know, it has a really great effect on the skin because where
Mhm.
there's skin, there's likely lymph.
That's
Yeah.
right.
And
Yeah.
there's a lot of lymph nodes around the face and the head,
Yeah, right. Yeah,
right?
totally.
So
Mhm.
when there's stagnation, you know, around the ears, around the neck, you know, in the head area, it can show up on the skin, facial skin, you
Mhm.
know, very, very easily.
Are there some techniques that are easy to do to get that drainage happening for the lymph system from the head and the neck area?
I love using complex homeopathy. I love
Mm, mhm.
inverting the body
Oh,
too.
yeah. Mhm.
You
That's
know,
a good
even
one.
something simple like doing a headstand,
Right.
or, just bending over can be
Right. If you can't do a headstand out there, right.
bend over, it's okay.
Yeah, right. Some type of inversion.
Yeah. And, there's some great practices such as jade roller. I don't
Oh
know.
yeah. I've
Yeah.
tried that. That's cool. I like that.
Yeah. You use the jade roller that kind of moves the lymph a little bit. But I think by and far, complex homeopathy is my very, very favorite.
Yeah. Oh, that's great. Well, okay, good. So we're getting things moving in the system and the liver's going, the hormones going, the gut's moving. Do you recommend doing a specific detox regime like yearly or seasonally to help the system to get things moving to help the skin be more clear?
Yeah, absolutely. Like, I think that we have to incorporate detoxification practices daily,
Right.
every single day.
Yes. Right. You can't just go on hiatus.
Right, right. It's not like, so I'm going to do this in the spring and in the fall. That's
Right.
not going to work for the skin. But, there are certain times of the year,
Mhm.
where doing a more in-depth detox can absolutely be really helpful. I
Mhm.
love doing one like around the spring equinox, which I think is coming up.
Yeah, March 21st.
Yeah. And then also in the fall, around the fall equinox in October.
Yeah. Oh, that's
You
great.
know,
Yeah, those are great times. And then your body's primed for the other seasons too, which is so important as the planet's changing, the trees are changing, our bodies are changing, moving from hibernation to hibernation.
Yeah, exactly. Yeah, they're
Yeah.
really great transition times to do it,
Mhm.
but daily detox is the most important.
Awesome. I love that. Okay, let's talk about mental health. And you mentioned a little bit earlier about stress, but I really like for us to kind of dive deeper in there into that subject because it's such, I always know that how big an impact stress plays, but I think we've really seen the huge impact it's making, but we're also going to see it continue to have after effects as we're moving further through COVID, unfortunately. So, how does stress really impact the skin? One part of the question. The other part, are there specific organs that are affected by that? Of course, the skin, that's what we're talking about. But yeah, are there other specific organs? And then what do we do to kind of help maintain that stress moving forward to help our system, especially the skin, to remain clear?
Mm. Oh, yeah, those are really great questions. So we could just spend days and days talking about all that
Right.
information. So when we experience stress,
Hmm.
our adrenals really get fatigued, especially when it's long-term chronic stress.
Right.
We're not designed for that.
No, we weren't made for that. I think
No.
we're all finding that out recently. Like,
Yeah.
wait a minute, I have to stay inside for how many days?
Oh, I know. Right? And so the chronic cortisol release, the chronic norepinephrine release, it just
Hmm.
fatigues the adrenals so much. And what happens in many individuals, especially those that are prone to acne,
Hmm.
the adrenals they're dysregulated. And so they start to secrete DHEAS,
Hmm.
an androgen. And
Hmm.
when that is elevated, it obviously can make acne worse. So
Mm.
there is a very direct relationship between dysregulated adrenal glands and
Hmm.
heightened androgens.
Yeah, that makes total sense.
Yeah. So, I see a lot of that with my patients. And also when cortisol is dysregulated,
Hmm.
our body is not able to balance our blood sugar and insulin levels
Oh,
properly.
right. Yeah.
Yeah. And dysregulated insulin produces something called IGF-1,
Hmm.
and IGF-1 directly increases androgens as well.
Okay, so you have
So
like double
that's
whammy.
another way. Double whammy, double
Yeah.
whammy. And not
Hmm.
only that, but the stress also increases substance P, which
Hmm.
increases androgens,
Hmm.
and cortisol can also displace progesterone, which
Mm.
can aggravate that hormonal imbalance of excess estrogen, low
Yeah.
progesterone.
So
So
stress
there,
has a huge impact.
oh my gosh, I can't even tell you. So often patients come to me and they're like, "Oh my God, my acne, my skin,
And
help
they're
me."
stressed out because of
They're
acne.
just stressed out, right?
Right.
And that's the really unfortunate thing about acne is it creates this vicious cycle. The more acne we
Mm,
get, the more stressed out we are. The more
right.
stressed out we are, the more acne we get. And
Mm,
it's breaking that cycle. that sometimes makes the biggest difference for
Yeah.
people in their clear skin journey.
Oh, that makes a lot of sense. And you mentioned earlier the Dutch test. And that's one test I'd love for you to talk about in relationship to the hormones. And is there other testing that you do or you recommend for seeing how the skin's working, like, gut dysbiosis or hormonal testing or adrenal testing, just some of those things that you mentioned
Yeah.
there, like some particular aspects of testing that can be useful in seeing what systems might be out of balance?
Well, I have to say the test that I use the most often, hands down, is GI mapping.
Oh, yeah.
Because I'm obsessed with the gut. I'm obsessed with the microbiome.
Yeah.
And I find that, healing the body at that level
Hmm.
just affects all the other levels so much.
So
Once you
it
get
does.
that in place, the
Yep.
hormones naturally fall into place. So that's my favorite one. The Dutch test, I do use that. I
And
mean,
that's a hormonal test.
that's a hormonal test,
Hmm.
exactly. And that is great to understand. My favorite part of that test is understanding how estrogen is metabolized in the body
Hmm.
and how we can support that to make
Yeah.
sure that estrogen is being properly cleared from the body. And then the other aspect of the Dutch test that I like is we're able to look at the adrenals and look at the
Hmm.
cortisol and just see, how much work needs to be done.
Right. What's the stress level at? Right. What level are you really at? We need to work with here.
Right. Like,
Yeah.
and usually the results are like, this is a priority. Like,
Right.
we really
Yeah.
need to adjust stress. It's not like just, you know, we need to give it the gravity that it deserves, right?
Yeah.
It has such
Right.
an impact on our bodies.
Yeah, and so it sounds like that there can be lots of different testing that can be done because there's lots of different systems. It's all coming back to the body relating in a specific way. So different aspects can affect the skin and cause that acne. So figuring out the root cause is part of
Yeah.
what you do, it sounds like.
I'm obsessed with it. I'm obsessed with figuring out what's actually causing
What's
acne
going on in
so we can
there?
solve it for good, because I know how traumatic it is for people.
Yeah. Yeah. I know I've seen the patients that I work with skin conditions. It's can be a huge deal because, especially in the workplace, when older women that I'm not saying old women, I'm saying older, like not in the teens, and then when they're having acne come up with something they've never even experienced before, it can be so traumatic because they, going into the workplace or going on dates if they're, or, all of that. And they sometimes feel lost because there's a lot of different information. And you mentioned earlier about pharmaceuticals and I'd love for you to kind of like touch base on the damage that can be done from using topical like steroids and things like that for skin conditions.
Yeah. So, the top medications that are usually prescribed for acne include the birth control pill,
Mm-hmm.
antibiotics,
Yeah.
spironolactone, and
Mm-hmm.
Accutane.
Yeah.
And, the one thing that I want to say about all four of those medications is once you come off those medications, your acne usually comes back. Even Accutane for
Yeah.
women,
Mm-hmm.
especially,
Mm-hmm.
acne will come back, and it will come back usually even worse than
Right.
before.
It like flares like the mighty beast. It's like, what have you done to me? You've suppressed me. You suppressed me.
Yeah, like nothing you've ever seen before. Like, you
Right.
may go on the pill because you have moderate acne, and when you come off the pill, you have really bad acne. And
Yeah,
I
that's
see
what
it
I've
all
seen
the
with
time.
the older women, in their 30s or 40s, where they don't need birth control anymore. They want to come off of it, and then they're like, well, why do I have acne now?
Yeah, yeah, it's a real thing. And
Hmm.
a lot of these medications come with side effects as well.
Right. Hmm.
And
Yeah.
these are, potentially really, really harmful side effects. I mean, Accutane, for instance, is a very, very potentially very dangerous medication.
Yeah, totally is. And if someone is using birth control, it's changing the way their hormones are working when they could be having the hormone issue could be the problem in the beginning, correct?
Yeah, well, what the birth control pill is, it basically stops estrogen and progesterone production in your body
Yeah.
and instead replaces them with synthetic hormones.
Right. So then your
Um,
body has a different message.
yeah, yeah,
hmm
yeah.
Yeah. So what are some recommendations of like top 3 recommendations that you would give? I know that you probably have so many bazillion of recommendations, but top 3 for helping with acne conditions. Let's talk about topical, just because I think, well, maybe you could talk about, we were kind of going along there and then I sidetracked us, how using like other topical products, other, face creams and things like that can be affecting your acne. Maybe one, talk about those like synthetic products, and then some recommendations that you have for some topical use to give people some type of relief, even though there's so
Yeah,
many issues we know that are going on the inside too.
yeah. And topical care for acne is a really big deal and it's really important. And
hmm
many of my patients come in to see me and their acne is very inflamed. And a lot
mm
of it is because they are over cleansing their skin
hmm
and they're over exfoliating their skin and they're basically damaging the
Right.
moisture barrier of the
Yeah.
skin. And this is happening all the time. And even with, things that you get from the dermatologist, the
Mhm.
retinoids,
Right.
those are very stripping for the skin. They damage the skin. And when the moisture barrier is damaged, the skin is more vulnerable,
Mm,
not only to acne, not only to redness, itching, but scarring and
right.
pigmentation as well.
hmm
So, a lot of the things that we do topically for our skin can be incredibly damaging for our skin.
Mm.
So, my mantra and what I teach my patients is less is more.
Yeah, that's a great one.
Less is more when you have acne. You don't need a bunch of steps. The first priority is to heal the moisture barrier.
Mm,
So, this means taking out all those harsh products that are drying out your skin and
right.
exfoliating your skin, and instead replacing it with a very simple cleanser.
hmm
Something that once you cleanse your skin should never feel dry. It should never feel tight or uncomfortable. It should
Right.
feel moist and soft
Like
and
you ripped off the moisture layer, right? Not a good feeling.
yeah, not a good feeling. You want to feel amazing
Yeah.
after you wash your skin. And a very gentle moisturizer, something extremely simple. It doesn't have to be jam packed with actives.
Right.
We just need to ensure that we are protecting our moisture barrier when we moisturize.
hmm
Um, and at the beginning of somebody's clear skin journey, I will just use very simple products on their
Right.
skin. As their moisture barrier starts to heal,
Yeah.
then we can maybe add a few things in, light exfoliation, because that is very nice and it does make the skin look very beautiful. But it won't if the moisture barrier is not intact. So
Right. That makes total sense.
So yeah, there's a
Yeah.
bit of a progression in terms
Yeah.
of skincare, but
Yeah.
less is more. And if your skin is red, dry, itchy, irritating, flaking, peeling,
Mm,
whoa,
yeah.
you need to go
Something's
way,
going on.
you need to like go way back and keep it very, very simple until that
Mhm.
moisture barrier heals.
And what about for people that wear makeup? Can that be changing the chemistry on the skin and changing the moisture barrier?
Yeah. So, one thing when my patients come to me, if there's a dysbiosis in their
Mhm.
gut,
Mhm.
which means there's often an imbalance in the microbiome on the skin, using a lot of oils can
Mm.
often lead to something called fungal acne.
Mhm.
And
Yeah.
so a lot of makeups contain oils. So you want
Oh,
to be
mhm.
sure to read labels, make sure that your makeup is non-comedogenic, and even just avoid anything with oils in it for a period of time until you get the inflammation under control, and then
Yeah.
you might be able to tolerate more.
Right. So it sounds like keeping things simple is the key in the beginning, which I love that. Why make things so
Yeah,
complicated?
right. And the skin is incredibly intelligent. It
Mhm. Yeah.
actually really knows what to do. when you have acne, it's communicating with you.
Right. Hello.
Yeah, hello, something's wrong. And it's very overt in its communication,
Right.
right?
Yes, this is
It's
true.
like,
That's
I'm
one
gonna
thing
be,
about the skin.
I'm going to be right on your face, so you
Right.
can't ignore me.
Yeah. Okay, that's great. So, what are some then your top three recommendations for acne? Like if you're going to pick, your top three ones.
Okay, well, one of my recommendations will have to do with diet for sure.
Right.
No dairy. Cow's dairy is awful for acne,
Mm,
and sugar as well,
right.
because sugar increases the insulin. So
Yeah, those are bad. I know.
bad.
Bad
And I
ones.
think
Yeah.
they're bad for everything,
Right.
right?
Yes, exactly. But especially when it comes to the skin. And you know
Yes.
what I find too? You mentioned the elimination diet earlier. It's so amazing when you do an elimination diet, those things are always taken out. And it's amazing how fast the skin clears. You're like, oh, look
Right?
what was bothering my skin.
And it's also amazing how so many other symptoms disappear as well.
Right.
It's not just the
Yeah.
skin.
Totally.
Yeah.
Okay. So nutrition. So dairy products. And are you talking about just cow or all dairy products in general?
Just cow.
Just cow. Okay. And then removing sugar.
Yeah. So the other one, stress. You have
Huge.
to, learn how to manage stress, because most
Yeah.
of us don't know how to.
Right.
And, it's a big lesson. It's probably one of the biggest and most difficult skills.
I
We,
totally agree.
but we need to really put emphasis and make that a priority.
Yeah. It's so interesting with stress because we're ingrained of learning how to deal with stress from a very young age, deal with it or not deal with it. So then to learn, it's like we have to relearn how to manage stress. And for some people, that can be super challenging if they have this long pattern of how they've managed stress or how they function, maybe like like a type A personality or something, go, go, go. And they're like, they don't know how to relax.
Yeah. It can be a really big deal. And yeah,
Hmm.
I'm like forever trying to master
Right.
stress.
Oh, like the stress guru.
Yeah, that's going to be my biggest life lesson, I think.
I think for everyone. Okay, so
Yeah.
number two is stress. And what about the third one?
Support your organs of
Oh,
detoxification.
yeah. Mm-hmm.
Yeah. And let's see if there's one specific thing I can recommend on that level. One thing I love people to do is drink lemon water in the morning
Mm,
when they wake
yeah.
up, before consuming anything else, because the lemon is
Mm-hmm.
so terrific. It stimulates bile production, which
Mm-hmm.
helps the liver detoxify. It stimulates a bowel movement.
Mm-hmm.
That's a really beautiful habit to get into every day. Just getting up, drinking your lemon water,
Mm-hmm.
helping your body detoxify natural. Super simple, but
Yeah.
effective, right?
I love that one. Yeah, that's one of my go-tos. I have like my 6 morning go-tos, and that's the one. Like as soon as I get up, I'm like water with lemon because it hydrates your brain. Your
Yeah.
brain hasn't been drinking all night. It's been
Yeah.
using all the other fluid that it can that you saved up during the day. And if you're dehydrated the day before, your brain's not going to be too happy with you the next day.
Yeah, absolutely. It's essential. You're right. Like you
Hmm.
just think so much better.
Right. Clarity is key, right? Okay, let's talk about your amazing program, the 7-week clear skin program. Can you talk to our listeners kind of like what that's about and how they can find out about it on your website and how they can register, but really like how someone can go from having acne and skin problems and go through that program and then da-ding.
Yeah. Oh gosh, this is my baby. I love this program so much. And I worked in one of Toronto's busiest dermatology clinics for 14 years.
Mm,
And this is really, I've put all my best knowledge and everything I've learned, I've put into this program.
mm,
And it's really designed to take people that are suffering with acne on a clear skin journey, where we deeply address all the things that we've just talked about,
mhm.
in this interview. And I give you tools and tips to help balance your body from the inside out. And I've been doing this program now for 3 years. So is definitely changed,
Right. Oh, it's always evolving.
it's always evolving. And I'm so proud of the place where it's at right now. It's helped thousands of women from around the globe clear their skin.
Wow, that's great.
Yeah, it's super, super exciting because it's a very empowering program for people
Mm,
because it teaches you how to take control, heal your body from within and not rely on, other ways to clear your acne that aren't effective and that aren't necessarily safe.
yeah. Oh, I love that. And is it an evergreen program? Can people sign up at any time, or is it a program where you're running like every certain time of the year?
Yeah, no, they can sign up at any time.
Oh, nice. Great.
It's self-directed, but there is an amazing Facebook group, that's
Awesome.
always going on. So there's
Yeah.
lots of support. There's
So it's a
lots.
DIY program.
Yes, yeah,
Fun. Yeah.
exactly.
Nice. Well,
Yeah.
that's empowering because then it helps people to really be motivated to learn and discover what's going on with their skin. That's great. And how can people find out about the program and sign up?
Great. Well, you can visit my website, which is naturopathicbeauty.com. And I have a great masterclass there that you can take for free. There's also a really interesting quiz that can help you determine the root cause of
Ooh,
your
I love
acne.
quizzes.
And you can also visit me on Instagram. I'm always giving, great tips and support for people suffering with acne on Instagram and Facebook and YouTube too. I do weekly videos
Yay.
there. I'm so obsessed with acne that I just talk about it all the time. So if you want
That's
to
great.
you
I
want
love
to join in the
it.
convo, that's where you can find me.
And that's all at Naturopathic Beauty. And I'll
Yeah.
post that all in the show notes so everybody listening can find that really easily. Oh, great, Dr. Stacey. Anything else you want to add as we're wrapping up today?
Oh, well, just thank you so much for having me. And, to everybody out there that's suffering with acne, there is hope.
Hmm.
Remember, there's always a reason for acne, which means there's always a solution and you don't have to suffer. So I know
Yeah,
there's a lot of suffering out there.
that's great. I love that. Okay, one last fun question. If you had an unlimited budget, what would you do to make the biggest impact on the planet right now?
Oh my gosh, that's so wonderful. Gosh, you've totally caught me off guard with that question because there's so many things that I want
You're
to
like,
do.
wait, I thought it was going to be about acne.
But I think that the one thing that just really hurts my soul is that some kids don't have enough to eat. And I think
Mm,
I would, do something to help make sure that all kids everywhere have enough to eat.
yeah, food. Everybody should have nurturing food. Yeah.
Everybody should have healthy food. And,
Mm.
I think that that's my one thing. And I don't even know if that directly answers your question
No,
because
that was perfect.
that
I love
does
it.
it.
Yeah,
Okay.
ding, you got that one. Yeah, that's great. That's maybe not the easiest one, but I think that it can totally be accomplished. We have so many great minds on the planet, so that's wonderful. Yay. Okay, thank you, Dr. Stacey. It's been a joy to have you on the show today, and thanks again.
Thank you so much, Dr. Lulu. It's been a pleasure.